HB 611 by Representative Freeman. Ms. Dixon, can you please read it in?
Members, this is House Bill 611 by Representative Freeman. It provides relative to pregnancy-related service centers to require licensure by the Louisiana Department of Health for pregnancy help centers providing healthcare services, to provide for definitions, standards and oversight and enforcement and penalties, and to provide for related matters. This bill does have a set of technical amendments.
All right, members, I'll offer the set of technical amendments. Can you read them in, Ms. Dixon?
Members, this is Amendment Set 3284 in your folders. All the amendments are purely technical.
All right, are there any questions? Hearing none, any objections? Amendments are adopted. Representative Freeman, on your bill.
Thank you, Mr. Chairman and members. This bill is in an effort to help the moms and babies across the state. We do have a low maternal health outcomes. Sorry, this is my third bill of the day. and y'all been listening to a lot. So it's based on a report that our legislative auditor did in September of 2025. And the report is Pregnancy and Baby Care Initiative. I didn't give you all the whole report, but of course you can catch it on the legislative auditor's website. It's all public. But I did give you specific pages because the bill that I put together is based on some of the suggestions by our legislative auditor. Essentially, there are many needs of our pregnant moms in this state, and essentially what I'm trying to do is make sure that they're getting the best medical advice as they go forward. What I had learned from the report is in many instances, people will go to get some services at these centers. And for example, an ultrasound is being read by somebody who is not a technology trained ultrasound. We just talked a lot about this. I think I heard towards the end of what y'all were talking about. But so there is no medical supervision over the readings. And that has great concerns for me because by the time a mom might go see an actual physician or come into the emergency room, something could have been missed, for example, an ectopic pregnancy that was not diagnosed because whoever was doing the ultrasound did not have the knowledge or base to work on that. I have worked with Secretary Harris of DCFS on this bill, and I haven't spoken directly to LDH, but they are aware of the bill. And I've also worked with the Louisiana State Medical Board. Dr. Collada had multiple conversations, even had conversations with the Catholic Archbishop group. Their particular pregnancy centers have a licensed physician overseeing the reading of their ultrasounds. And many of you probably already know this, and some of you do and some don't, but my sister had a very, very high-risk pregnancy 15 years ago and almost died. She would be the kind of patient that we'd worry about because her doctors told her what was happening. She moved into Toro Hospital, lived there for 3 months. She is still alive, but baby Thomas didn't make it. But I tell her story publicly. She allows me to because what I worry about is that if somebody like my sister's complications just had somebody reading an ultrasound who's not certified to read an ultrasound, they may not know until they hit the emergency room and they're bleeding to death. So that's what I'm trying to do is protect all the moms and babies in our state and make sure that they get the best possible care so that we don't have these maternal outcomes and that we stop being on the top of the list for maternal outcomes and babies not being healthy. So I'm happy to answer questions, and I know there are probably plenty, and that's essentially what the bill does.
Thank you, Rep. Freeman. I don't see any questions just yet, but there are some people who want to testify. I'll take the green cards first. Zoe Leach, Melissa Golden Evans, and Julie Swan Harris. I'm sorry, Julie Swan Harris is here in support but does not want to speak. Whichever one wants to start, please state your name and give us your testimony.
All right, thank you. Hello. Hello, I'm Dr. Melissa Golden Evans, and I'm faculty member at Tulane University's Weatherhead School of Public Health and the Mary Amelia Center for Women's Health Equity Research. I'm here to speak in support of HB 611 in my own personal capacity and not as a representative of Tulane. My areas of expertise include maternal health and healthcare access. Our state, unfortunately, has a distinction of having some of the worst maternal and infant health outcomes in the country, and our racial disparities in these outcomes are even worse. There are many factors that contribute to these high rates of adverse maternal and infant health, one being access to high-quality health care. Pregnant women are more likely to have healthy pregnancies and deliver healthy babies when they receive the recommended number of prenatal care visits. The first prenatal care visit should occur between 6 and 10 weeks to allow for the identification and management of pre-existing conditions that can negatively affect maternal-fetal outcomes. However, there's a shortage of obstetric care in Louisiana. We're experiencing a provider decline in our state, and nearly a third of Louisiana parishes are considered maternity care deserts, meaning they lack hospitals, birth centers, or OBGYNs. Many of these parishes have a higher proportion of rural, low-income, and Black communities, and so this means that 51,000 women in Louisiana have inadequate access to prenatal care and sharply elevated risk of dying from preventable pregnancy-related causes. The reason I'm here to support HB 611 is that many pregnancy centers, also called crisis pregnancy centers, present themselves as sites that provide medical care, and some very well may. But since Louisiana law does not explicitly require medical licensure for such centers, as they would for any legitimate healthcare center, who is to know the quality of the pregnancy-related care at these centers if it meets the well-established standards for prenatal care? Even your neighborhood nail salons are held to a higher licensing standard than these pregnancy centers. If a woman learns she's pregnant and seeks care at one of these centers because she lives in a maternity care desert, because this is all that she has access to, what kind of care is she receiving? Are they providing sound medical advice for a woman in her first trimester, the trimester with the most critical phase of fetal development? Are they running the appropriate tests? Could she even be screened for preeclampsia and start prophylactic treatment in her second trimester? If these centers provide pregnant women with inadequate care or misinformation during pregnancy, they're putting that woman and her baby at high risk for adverse maternal and infant health outcomes, including death. In a state with shortages of pregnancy-related health care, in a state that purports to be pro-life, we should be doing everything we can to ensure prenatal health care is available, evidence-based, and at a minimum meets healthcare licensure standards.
Thank you, Dr. Evans. Ms. Leach?
Good afternoon, Chairman and members of the committee. My name is Zoe Ray, and I'm a social work and public health master's student in Louisiana. I'm here today to speak on behalf of myself and the countless individuals who are impacted by deceptive practices of unlicensed pregnancy centers. Several years ago, as an undergraduate student in New Orleans, I was seeking information and medical guidance related to my reproductive health. I needed timely, accurate information to understand my options and make informed decisions. Believing I was going to a legitimate medical provider, I went to a facility on Claiborne Avenue called the New Life Clinic. The building looked like every other doctor's office I had ever visited. I was given medical history paperwork and sat in a waiting room under the impression that I would receive unbiased professional care. I was even told I could receive an ultrasound. Instead of receiving clear information and care, I experienced delay, misinformation, and a lack of transparency about the nature of the services being provided. As a social work student, I am trained to uphold the ethical principle of a client's right to self-determination. What I experienced was a direct violation of that principle. This center did not exist to support my health. It existed to influence my decisions while presenting itself as a medical provider. This is exactly the gap that House Bill 611 seeks to address. Right now, centers can offer services that appear to be healthcare, such as pregnancy tests, ultrasounds, and counseling, without being licensed or any oversight, and without being held to basic medical or ethical standards. Patients walk in expecting care and instead receive something entirely different. People seeking healthcare deserve accurate information, transparency, and ethical treatment. No one in Louisiana should walk into a facility that looks like a medical clinic and leave without clear answers about their health or where to go for legitimate care. I urge you to support this bill. Thank you.
Thank you. I'm going to go to some red cards now, if we can clear the table. Mr. Ben Clapper, Dorothy Wallace, and Erica Enzina.
Whichever one wants to start, please state your name for the record, please. Hello, my name is Dorothy Wallace, and I'm President and CEO of Caring to Love Ministries. I have served girls facing crisis pregnancies and with pregnancy scares for over 4 decades. In 1980, here in Baton Rouge, office alone, we served over 137,000 clients, and over 87,000 babies have been born. I want to stop for just a moment and address the ultrasounds that we do. In the last few months, we have sent 3 girls with ectopic pregnancies to Women's Hospital for emergency surgery once we realized that she was experiencing ectopic pregnancy. I also want to say that our radiologist and our medical director reads our ultrasounds. We would not have been able to immediately have sent these girls to Women's Hospital to save their lives because they were experiencing an ectopic pregnancy. Many of women who seek and to continue their pregnancy report experience pressure and coercion to terminate their pregnancy, and we are there to help them if they have desire to carry the baby to term. We learned early that young girls who want to have their baby are at risk, particularly with their partner and loved ones and family members. In such case, one of the young girls that came in to receive our services, she decided that she was going to have her baby. To my dismay, she was slammed against the wall by her partner because she made a decision to carry her baby. We were able to get her back into safety and have him off the premises, and she wanted her daddy, she wanted her father to come pick her up to take care of her. So since 1980, when I wanted to start my pregnancy center, there was no regulations for me to follow. So I did my research. So I contacted Steve Phillips with the Department of Health, and I asked Steve, I said, Steve, what do I need to do in order to get my pregnancy center started? He said, well, you know, if you, all you need is a medical director, because the abortion clinics have medical directors, so you should be able to have a medical director to start your pregnancy center. So we did. So since 1980, we have had a Louisiana board certified medical director that governs our pregnancy center. So for more than 4 decades, we have operated under that. So we also have had DCFS come and do a site visit. They watched our nurses. We have our nurse practitioners. As a matter of fact, the medical director is the founder of the birth center. That's our medical director. So respectfully, members, I would ask that you would join with me in opposing House Bill 611, because we are governed by a Louisiana board certified physician, and there's no cost at all whatsoever to our clients. Every services we provide for our clients are at no cost. Thank you.
Mr. Chairman and members, my name is Ben Clapper. I'm the director of Louisiana Right to Life. And for clarification, Louisiana Right to Life does not operate any pregnancy centers. We are just believe they're important for the state, and so we're advocating on their behalf here today. I don't want to take a lot of time because there's a lot of people that have traveled to speak on this legislation in opposition. Louisiana Right to Life is opposed to this bill. We are an organization that advocates for the protection of life and the support of moms in the state, both before and after birth. And pregnancy centers are essential to the work of caring for mothers and babies in this state. There are, maybe 25 to 35 pregnancy centers in the state, and they're in many of your districts and your communities at no charge, like Mrs. Wallace said, providing these services and helping people, as you'll hear from other testimony today. I do want to share that the only states that have passed this legislation or legislation like this are California, Connecticut, Massachusetts, New Jersey, and New York. These states have a very clear record of advocating for abortion almost essentially on demand, and at the same time villainizing the work of pregnancy help centers in the state. So if we want to join those states, then this would be the legislation to pass and move forward. Many of these pregnancy centers, again, they don't charge for service, so they rely either on donations from the community, or maybe if they are in the group that are supported through the state funds that you've authorized through DCFS, or some combination of both. But they are community ministries, nonprofit organizations that are supported, and to put this type of burden of regulation upon the centers, I worry would really hurt and damage them, and we would not want to see any of these efforts shut down in local communities. So I encourage you to vote against this bill today. Thank you.
Hi, everyone. Erica Enzina, attorney and policy director with Louisiana Right to Life. I want to start by saying, just to differentiate, of course, pregnancy centers come in many varieties. The ones we're talking about that are implicated by this bill are pregnancy centers that provide health care services as defined in Section 3 of this legislation. And those kind of healthcare services include primarily ultrasounds and pregnancy tests. So there, again, are three main reasons that we would urge you to oppose this bill, among others, but I'm trying to keep it short for you. Like Mrs. Wallace said, and others will testify, any healthcare services like ultrasounds or pregnancy tests are provided under the licensure of a medical director. So this is unnecessary and it's duplicative of oversight that already exists. However, it would be extremely burdensome for the pregnancy centers. If you've ever visited a pregnancy center in your district, and if you haven't, I really encourage you to do that. You'll be very inspired by what they do. You'll know that they are usually operated by a small staff and with limited funding from donors and, like Mr. Clapper mentioned, some relatively limited funding from the state, and not all of them even receive that. This will require them to use their limited resources to comply with licensure, but there's no real benefit to the clients that they serve. The language also is very broad and vague. Even though the bill states it doesn't apply to centers that provide non-healthcare services, this definition is really wildly vague, and the consequences are steep, in the tune of $5,000 per day for a violation of this. I want to point out a few other things. There's a very high fiscal note associated with this for just 1 year. It looks like it's $643,678, and over the course of that fiscal note would be a significant burden, even more money than we're spending as a state to provide some monetary support to these centers. And I also want to leave you with a question of who else this sweeps in. Does this incorporate doctors' offices? Does it incorporate ultrasound boutiques who primarily run just for the purposes of providing moms with a quick peek at their baby early in pregnancy or at any time during pregnancy? Another question to ask is, or to point out, is that Louisiana law permits doctors to issue standing orders. This is not unique to pregnancy centers. There are lots of other examples of healthcare-related entities that provide healthcare-related services under the standing orders of a physician. So my question is, why would we single out pregnancy centers? It also sounds like, I'm looking at page 1, lines 19 through 20 under the purpose. It says, the purpose of this part, and I'll fast forward, I'll just point you to that part. My question is, what is really the purpose? Is this to essentially force pregnancy centers who are ministry-based and are not meant to replace prenatal care for women to become centers that are primarily prenatal care? And like I said, I would look at page 1, 19 through 20, those lines. And with that, I'm happy to answer any questions that you have.
I have one quick question. Do you know any company, you mentioned different rules for different companies. Do you know any company in the state that does ultrasound, imaging, medical screening, and diagnostic services besides pregnancy centers who aren't licensed?
Yeah, absolutely. I've been to several of them as an expecting mom, just to see my little baby in utero before it was time for me to go to the doctor or to do a gender reveal before it was recommended by my doctor to do.
Talking about the 3D ultrasounds?
Correct. Yes, sir.
Just to get a picture, right? And then to
Just
know
to
if
get a
it's a
picture.
gender. Okay.
Correct. But they are, under the definition of a pregnancy center in this bill, it seems like they would be incorporated into this licensure, which, they're not providing any medical care either. So I feel like that would be rather unfair to them as well.
Think of?
That provides imaging,
imaging, medical screening, or diagnostic services that are not licensed with the Department of Health?
I can think of IV clinics, like wellness IV clinics like that, and those aren't imaging necessarily, but what I would point out about those is that they provide much more invasive services than pregnancy centers offering ultrasounds. Needles, cocktails of different varieties.
So what is your
vitamins.
ultrasound? What is the purpose of your ultrasound at the pregnancy center?
I'm going to defer that question to the pregnancy centers or Ms. Wallace.
Not a trick question. Seriously, I'm
No,
just curious.
she's
like,
better to answer the
if
question than
someone
I
was to
am.
come there, like, why would y'all do an ultrasound?
It's very important to be able to determine, the ultrasound actually determines whether the client is pregnant or not. And we find it very helpful because we are very much concerned about young girls who are testing positive, having abortion pills in their hand, being told by the abortion dispensaries to come to organizations like ours to get an ultrasound, and especially post procedure. And that's why we're able to send them to Women's Hospital so they can go and get the emergency care that they need. Could you imagine if these young girls had taken the abortion pill with that ectopic pregnancy, the fatality that could have possibly happened? So it's for pregnancy verification. So and that's what the purpose is.
So why would that individual come to you for the ultrasound versus going to emergency room or to the OB doctor?
Excellent question. That's the question that they are being told by an industry, an unregulated industry, that these girls are bleeding, and they are bleeding for weeks and weeks. And so they encourage them to go to a pregnancy clinic and to get an ultrasound to make sure that everything is, that the baby is no longer in
So
uterus.
most individuals that come to you after they've attempted abortion?
But that's what they're asking them to do. But if they're bleeding, we ask them to go immediately to the emergency room.
No, I understand. I was just trying to understand which, most of the clientele.
If I may, I might add a little context to that. Another benefit of the ultrasound, the early ultrasound, is that this is what the women who come to the pregnancy centers are in some form of crisis or a state of unrest. They don't know that they're pregnant. They haven't been able to confirm that they're pregnant. Maybe they don't have health insurance. Maybe they don't know about all of the state-funded resources that are available, which, by the way, the pregnancy centers point them to. Oftentimes the women come in for an ultrasound just to confirm that they are pregnant, and then the pregnancy centers connect them to the vast amount of resources that we have in our state that can help them. They walk alongside with them in that effort, but then they also help them get in line with a doctor, OBGYN, oftentimes providing referrals to them. So on one hand, it is for confirmation of pregnancy. On the other hand, it's the first thing that a woman wants when she walks into those doors, and then she's connected with all of the resources that are available. Whereas without that ultrasound, she may just not go, right? And that is certainly her prerogative if she doesn't want to go. So it's more complex than just like there's a single purpose for it.
Thank you. Representative Landry for question.
Yes, ma'am, in red, what's your name? I'm sorry.
Dorothy Wallace.
Dorothy Wallace, and what's the name of your facility?
Well, it's called Caring to Love Ministries, Care Pregnancy Clinic.
Okay, so these questions are just for you. So that was good to know, everything you talked about, sending someone who's bleeding and the ectopic pregnancies. You're doing, from what it sounds like, what you're supposed to do. And so if there's basic healthcare regulations, I don't think it would apply to you because you're doing what you're supposed to do. But from what I understand, there's around 30 entities that call themselves pregnancy centers. I mean, do you know what's going on in some of those?
Well, let me just say that the pregnancy centers that I started across the state, they're doing exactly
They're multiple?
what they're supposed to.
I'm sorry, I missed that if you said how many.
They're doing exactly what they're supposed to be doing. And so when I administered the abortion alternatives from 2000 to 2021, those pregnancy centers that were participating with that funding were doing exactly what they're supposed to be doing. With the medical director, of course, we have nurse practitioners and we have RNs and LPNs that provide our services. So I would probably say the majority of the pregnancy centers across the state are functioning like mine.
Well, but You know what yours are doing.
I do know.
But you don't have 25 of 30 or 20 of 30. I'm just saying there's many out
I
there.
probably have to say that we self-regulate ourselves. I'm the co-founder of NIFLA, which is a legal organization that started in 1990, that the directors would go to our conferences and they would learn how to do best practices within their community. So we are an organization that regulates ourselves across the state. And so I really can't discredit any pregnancy center in Louisiana because I've not heard of anybody that I've been in communication with that would be doing anything less than what we're doing.
But you have no way of knowing, is my point. And self-regulation, I'm speaking, self-regulation of a healthcare facility is, I think, the opposite of what the Health and Welfare Committee wants. And I think we're straying from the point here, which is to make sure care is safe. And there are a lot of places out there that they purport to offer health care, or the patient going, think that's what's happening, and it's not happening. So if something like this were to pass like this or in a different frame, it sounds like it wouldn't even apply. It sounds like you wouldn't have to change your business model because you're already doing these things. But I do have a question about your medical director. Is that person actually providing care, or how does that work?
Well, a medical director that we have does give standing orders to our nurse practitioner, and our medical director is on site frequently.
So how does that?
And of course, our clients are sent to Women's Hospital, Baton Rouge General, OB, and Ochsner. So they go to different OBs once they're handed off with our nurse practitioner.
That's great. But if someone walks in and says, I might be pregnant or I might be bleeding. Well, bleeding, you said you send them out. Yeah. But how does the medical director interact with that person who walks in?
Of course, he's not seeing all of them, but he would see them, and as a regular patient that would come in for their first visit, and then they'd be handed off to our nurse practitioner.
So if a patient or client, whatever you refer to them to, walks in, do they always see someone with a medical background?
They always see an RN or a nurse practitioner.
Okay. But that's probably just your facility. Well, you know it in your facilities, but you don't know in the other facilities.
I know in other facilities there are RNs and that are providing services. Medical personnel are providing services.
So, but that's not required. And I think what we'd like to see is that it's required that someone with an actual medical background is giving that advice. And from what I understand, I don't think it's required to have a medical director. Is that correct?
It is required to have a medical director.
Is that right? Okay, so
Absolutely.
But it's not required that they have an RN or anything like that in the facility.
Most medical directors would feel very uncomfortable being the medical director if they didn't have a nurse that was providing services.
Well, most would be
under his license. And as a matter of fact, I'd be safe to say 100%.
So if we were to require it, then it might not actually change anyone's behavior if they were already doing that. So I think requiring it doesn't actually do anything if everyone is following the law.
May I speak?
Yes.
I think that we're already doing excellent work and with professionals, with medical malpractice, with all the insurance that we handle. And caring for our clients, and we just think this is unnecessary. That we've done this great work for me over 4 decades, and so we are governed by our medical directors, and I think that that's why I oppose this bill. There shouldn't be.
I mean, what we do in here all day, for the most part, is regulating all kind of different, the radiologists and whatnot, because that's what we need to do to make sure people who live here are receiving safe health care. And so I think one of you brought up the singling out, and if that's how you feel like it's because there is no regulation, and we have regulation everywhere in healthcare. So this is actually for you. Why do you think this, I guess, area of healthcare does not need regulation, but everywhere else needs regulation?
Angie.
I can answer, and then Angie Thomas can also provide some context as well. Because it is regulated under the medical licenses of the doctors that are the directors of the clinics.
But they're not
that is-
required.
But they have them, and I think Angie can speak more to that. They do. They have medical directors at these clinics if they're providing these services. Not all clinics provide these services, and not all of these would be incorporated into or implicated by this bill. But there is a lot of vagary in the language, such, for example, on page 2. Give me just one second. Healthcare services means services that constitute or involve medical care, including but not limited to any of the following. And I'll point you to D, pregnancy counseling or consultation presented as medical advice. That's wildly vague for a clinic who is not even offering ultrasounds or pregnancy tests. To be able to comply with that, how do they, like, what is medical advice? That's not defined.
And to define it further.
Well, I'm pointing out that this is a chronic problem throughout, that it's a rather vague bill, and these centers who are not meant to replace prenatal care are meant to be that first line of support for women, and oftentimes what they are wanting is confirmation of their pregnancy. This puts an undue burden on them in obtaining licensure, and then also an undue burden in the potential for violations, $5,000 per day if they're in violation of this.
I don't know if that's high or not. I mean, it is high if you're giving someone quack medical advice, and that's
I don't think anybody's
concern.
giving anybody quack medical advice.
Then this is no concern to anyone if it's not happening. But there are quite a few places that say they're a pregnancy center that don't fall under the Baby Care Initiative, that are not applying. Well, I guess if they're applying, they're not one yet, that might be doing all this. And it actually seems like the pregnancy centers are asking that they be singled out from anywhere else that offers health care.
Well, like I mentioned, several of the other types of entities, and in fact, Chairman Miller, I'm so sorry, I thought of one. My chiropractic office has a medical facility within it that operates under the orders, and they perform x-rays and ultrasound and all sorts of medical actual medical care, shots, they prescribe medicine, and they're doing this under the standing orders of a physician. When I go there, I see a nurse practitioner. I've never seen the physician who is the medical director of that facility. So my point is that
I know Rep. Landry is asking questions, and I'm sorry. Your chiropractor?
Yeah. Mm-hmm.
Chiropractor is licensed, though.
But the medical side of his clinic is under the standing orders of a physician. It's not regulated by LDH.
The medical side? So, like you're saying, a nurse practitioner giving care, they would be
Yes,
licensed.
Sir. Under the medical license of the medical director, which is what these clinics have. They have a medical director that oversees the.
Look, I'm not trying to be controversial at all with your bill, but any medical clinic that has a nurse practitioner providing health care is licensed with LDH. Yeah, no. That was only the question I had was, did you know any companies that was not licensed by LDH? But all medical clinics are licensed by LDH.
I think there is some gray area in there, and I won't purport to be an expert on that.
They won't get reimbursed by any of the MCOs. I know y'all don't get reimbursed either, I don't believe.
But
they
these,
wouldn't
for cash patients, a lot of these services are cash services, or I'm not talking about pregnancy centers. I'm talking about other entities, like, for example, the ultrasound 3D boutiques. You're not getting reimbursed by any medical provider. Medical insurance for that. It's a cash business.
No, I understand. I'll return back to Rep. Landry's question.
So you would only know this for your facilities. Is the person who's interpreting the ultrasound the medical director?
Yes.
Always?
He's an OBGYN medical director.
And he interprets all the ultrasounds?
He sure does. Signs off on every one of them.
How many did you say you run? How many centers?
Well, the one I want to focus on is the Baton Rouge one. So I'll just say the Baton Rouge for right now. But Baton Rouge, Lafayette, I don't run them. They have other directors that are quite capable of running those pregnancy centers.
Okay, so just the one here.
All I did was start them, and I'm there for them if they need any assistance.
But you would only know that one. And then Rep. Freeman told me that legislative auditor report, which is incredibly detailed, that out of the 12 centers in the PBCI that perform ultrasound, only 9 have a doctor on staff. So we do have evidence from Mr. Wagasbeck, I think he left, that at least 3 of the 12 in that program do not have a medical director on staff. So it might not be a problem with yours, but it is a problem with some. Do you agree or not?
Could it be that they are a volunteer medical director and they're not technically on staff? Maybe that could be.
I mean, I would not consider that adequate because the person who's a volunteer has no requirements to go in there.
They do. They are operating under the license and supervision of a medical director. So I hope I can be up here. My name's Angie
That's
Thomas,
fine.
Chairman Miller and committee. My name's Angie Thomas. I used to run a pregnancy center in the state. And just to answer your question first, several of them have volunteer medical directors, but that doesn't remove any responsibility from them. All of the medical services are being provided under the license and supervision of a medical director, and they are insured with medical malpractice, to do such. So these are already being regulated because they're being regulated as doctors, nurses, and other healthcare professionals like RDMSs. So when you say that we're asking to be singled out, we are not asking to be singled out. We already are regulated. If a pregnancy center is offering medical services without supervision of a medical director, then they're practicing medicine without a license, and we wouldn't want that either.
So I don't know if someone from the auditor is still here, but I'm pretty positive that only 9 of the 12 in the PBCI have a doctor on staff at all. So that is practicing medicine with.
Rep. Landry, I'm sorry, I'm going to cut you off, but the auditor's team is here if you want to
Okay.
speak.
Yeah. Thanks.
Stay here and I'll move so she can come here.
Is your name Miss Angie Thomas?
Yes.
Listen, after the line of questions are finished, I know you had a red card to speak, so you will be allowed to come back and give your speech.
Also, if the Secretary of DCF is here, we might as well have this brief conversation at the same time. Thank you.
Hi, my name is Emily Braun. I was the auditor in charge on the Pregnancy and Baby Care Initiative report that you're referencing, Representative Landry. And this is Gina Brown, the audit manager on the report. To address Angie Thomas's question specifically, pregnancy centers are not required to comply with staff licensing requirements because they're not a licensed healthcare facility. They're also not required to adhere to HIPAA data confidentiality requirements, and clients don't have a formal avenue to file a complaint if an adverse event takes place at a pregnancy center. We did specifically state that 9 out of the 12 pregnancy centers reported that they had a physician with an active license on that they had a physician with an active license on staff. So some of those pregnancy centers participating in the PBCI initiative did not have a physician with an active license on staff because they're not required to comply with staff licensing requirements. We sent out a survey to all 12 of the pregnancy centers that were participating with the PBCI initiative, and the responses that we received regarding staff licensing requirements, we found that 9 out of the 12 stated they had an active license. So.
And you only looked at the 12 in the Baby Care Initiative.
Yes,
did the
because
audit
they're receiving state funding.
Right.
Yeah.
Did the audit report mention at all around how many entities might be labeling themselves as pregnancy centers?
Yeah, there's Gina Brown, audit manager with the Legislative Auditor's Office. At the time the report was released, there were 38 pregnancy centers across the state, and none held licenses through LDH. And we found through our work that several of these centers were offering healthcare services without the regulatory authority of LDH.
So were you able to reach out to all or most 38, or that was just kind of like your research?
That was part of our research.
Okay.
Just to give some background information on the baby pregnancy centers and what they offer, how many, and then how many of those participated in the initiative administered through DCFS.
Yeah, because some of it sounds like are sort of counseling.
Right.
You know, what do you want to do next? Diapers, formula, and that's one thing. But more than a few of them, as we've all found through Google searches, are saying that they offer these services, and only 9 being licensed by LDH is a problem. And if this was literally any other issue, you wouldn't be sitting here because it would already be licensed.
The 9 are not necessarily licensed by LDH. So we found that none of the pregnancy centers were licensed healthcare providers, nor were they required to disclose that they were not licensed healthcare providers. So 9 of the 12 pregnancy centers reported that they had a physician with an active license on staff, but they weren't necessarily required to have an active a physician with an active license on staff. That makes sense.
Can you describe that a little more?
Yeah.
They weren't required because there's not a regulation over them.
Yeah.
Sorry. This is my third committee with bills today.
And so that kind of preempted our 2 matters for legislative consideration in this report. The first being that if you're not going to be regulated, if you're not going to have a license, disclose that. So the women that go there know that going in. And the second was to consider mandating that they are licensed if they're providing healthcare services. So those are the 2 matters for legislative consideration that are relevant to this legislation.
Yeah, I mean, for the 9 that have a MD on staff, well, they're doing the right thing already, but the rest of them, because they're not required to, they don't. I like your point of disclosure. That way they have a choice of which one to go to on that. Now, MD, was there any research about an RN or NP or anything? Was that looked at as well?
Now, the ones that even have a medical director, they're still not licensed through LDH. So LDH still is not regulating the health care being provided at these centers. So even though they may have a medical director or a registered nurse, it's not being licensed through the state.
And that's because they don't have to have a medical director.
And that's because it's not required
to
be licensed.
Is medical director here like a defined term?
Having a medical director isn't required either.
I know, but is that in law, like medical director means X?
I don't know.
Or you just say, I have a medical director.
Right. I don't
You're
know
not sure.
if it's defined in state law.
Okay. This is something you might not be able to say offhand, but was there like clusters of where these are located?
We have a map.
Yeah.
I know, sorry, I didn't print it.
Yeah. And a lot of the point of pregnancy centers is to be able to offer services to women in more rural areas that might not have access to certain services. So there are a benefit. Our recommendation is stemming from the fact to be licensed healthcare provider if you're going to provide healthcare services, and if not, disclose it.
Okay.
Yeah, there's a map on page 2 of the report that shows the 12 PBCI participating pregnancy centers are located throughout the state, and then
Did we map the 38? The 38.
We have them listed out in the appendix, Appendix C, with the name of the pregnancy center and the parish that they're in.
Okay. In case it didn't come out, the Louisiana Legislative Auditors, for everyone here, nonpartisan. It is appointed by the head of the Senate and House, which at the time are right now are Republicans. So they function as a research entity. I've used them plenty of times, so I'm not sure if everyone understands who that was. And then I think a last question on this. again, I wish I had it in front of me, that the maternity report found that the maternity healthcare crisis, which we all know about, that there was a correlation with lack of healthcare in these areas or at the centers. And if you could talk about that a little more.
Yeah, so in a previous report that we conducted on maternal health outcomes, we found that access to OBGYNs is limited for women living in rural areas, especially for women on Medicaid. So as a result, it's important for pregnancy centers to be transparent that they're not healthcare providers, because women may not know the difference when healthcare services are being offered.
Okay. And I think one of the report's recommendations was that these centers be licensed by LDH.
Yes.
Okay, yeah. Those are my questions, but I just wanted to state, since we all know what's going on here, the raising up the issue of abortion is purely to pressure the people on this committee. Abortion's illegal. And all of those clinics, which were heavily regulated, as I know well, for a long time, that was kind of the point for a long time, and they were regulated as healthcare facilities. So I think people pushing against this, it doesn't make any logical sense, especially with the auditor report. They are providing healthcare. If they're doing it right, it doesn't affect them. I really question the reason behind pushing so hard against the Department of Health, providing oversight here. The point here is for safety for mom and baby. So I appreciate the report. Anyone in here who has not read it, I highly recommend. It has a lot of information that I never knew about, and I appreciate y'all being here.
Thank you.
That's me.
You finished?
I'm sorry, I forgot. I can't read my handwriting for what I was asking you to do, but actually I think I was asking in relation to the ability or what you already might do, your association with these centers. I know you only really deal with the 12 PBCIs and to an extent Thrive, the telehealth. But if you could briefly tell the committee how you interact with the ones that are in the program and the ones that are not in the program.
Good afternoon, Rebecca Harris, Secretary for the Department of Children and Family Services. We do, through the Louisiana Pregnancy and Baby Care Initiative, which is a law in Louisiana, it's 46972.1, we administer the Pregnancy and Baby Care Initiative, and that is to provide a particular set of services, fund a particular set of services within pregnancy centers, maternity homes, adoption centers, or other social service centers. The services that we provide reimbursement for include counseling services, material goods, referrals to services, and then also classes that are intended to improve pregnancy and baby outcomes. We contract with 13 centers now today of the 39 that are available. We are negotiating contracts with an additional 7. The average amount annually is $100,800. And last year, in calendar year 25, the 12 centers that were under contract provided services to a little over 13,000 women. The majority of the services provided were referrals to other supports and counseling sessions.
It's a lot of people, that's for sure. Do y'all work with any other entities or issues that are essentially unregulated by LDH or you?
No.
Okay, thank you.
All right. There's Rep. Spells, your questions for any of these? It is? Okay. We're going to go to Rep. Spell for questions. Members, just to let you know, the House just came in. There are 6 personal privileges, and then we're going to get going with business. So at some point, we have to wrap it up here. Not rushing you at all, Rep. Spell. Take your time.
I'll be very efficient, Chairman. Thank you. Thank y'all for the report. I haven't been able to read it yet. I just wanted to, so I may be asking questions that could be in the report. Things have been mentioned like ultrasound or, medical services, et cetera. I guess my question is, in the assessment of said centers, they were those that are a part of PBCI and those that are not, correct? Mm-hmm. In that venture, in the assessment of, if said center, whether they are part of PBCI or not, and the assessment of, is there a licensed, healthcare professional on site or serving as a medical director, Did that also include questions of sonographer and ultrasound techs? They have their own licensure. So I guess that's my other question. Boards regulate the provision of services of said individual as a clinician, right? And they determine their scope of practice. And any moment of going outside of that boundary, the board would then have to discipline said licensee. And as I understand it, I'm not an ultrasound tech or a sonographer, but as I understand it, they are licensed. So I guess that's my other question. Was that assessed? If ultrasound is on site, is it done by a licensed, said person?
That's the question, because they are not required to comply with staff licensing requirements. We don't know.
Right. But I'm asking about the stats that y'all mentioned that, was it not, I'm sorry, y'all, 9 out of the 12 maybe did not have said MD. But my next question is, if ultrasound was the only medical service offered, was it then also asked, Hello Center, do you also, as you're providing ultrasounds, do you have an ultrasound tech that is licensed to do so on site? Was that question asked and assessed when you come up with a 9 out of 12? That's my question.
So I think we looked at it a little bit differently, a little bit more holistically, in that the facility itself being licensed. So when you go to a doctor's office, that doctor's office is going to have a license, and then everybody that works in it is going to have their appropriate individual licenses. So, your nursing board, your technician boards. So we were looking at it from a facility level, and, who they hire, we did not get into that, and specifically what licenses they have. We were more interested to see if the facility itself carried a license to be regulated if they were providing healthcare services, if that makes sense.
It does and it doesn't for me, because my question, I'm a licensed provider.
Yes.
And so there's been moments that what I've done has not been regulated or licensed by LDH. It has been in contract with said agency. And if there's anything that I do untoward said patient, my board is responsible for me and handling me. I've never had any board complaints, but I guess my point is this: I'm a little mixed on, because some folks are talking about, the licensure of said clinician. That does have some regulatory entanglement for that particular clinician. We're talking about licensure with LDH. Those are two separate things, in my opinion. What do those offer in terms of public safety? I think they're both valuable. I guess I'm trying to pick out the tea leaves when we say licensure or, license to practice. To me, those are two different things. And I feel like we're mincing our words here on that. And public safety is number one. But I guess that's why I was asking about y'all's report, if that included that of the licensed sonographer.
We didn't specifically look into the licensed radio technologist, like who would be conducting the ultrasound specifically, but if there aren't any requirements for that clinic or center to have a licensed stenographer or medical director or doctor on staff, then there aren't any requirements for them to actually meet those standards.
I guess my question is then they'd be,
So
providing medical care
ultrasound-
without a license. That in and of itself, as the statute stands, is the moment of a pathway to remedy that. I guess that's my question.
But there would be no regulation of that center if they're not providing appropriate care. There's no regulation of that center because they're not a licensed healthcare facility.
Sure, but there's other moments in healthcare where said clinician is licensed and offering service not in a licensed facility, and it's still within the laws. That's my confusion, I guess, on the report. I won't belabor it.
Right.
I was just asking on the numbers if it was ever assessed if someone was a licensed sonographer. Sorry.
No, our matter for legislative consideration went back to the regulation of the facility, not the individuals, because what being regulated as a healthcare facility does, it gives the patients different types of avenues through the state. So that's what we focused on.
Thank you. And I haven't read the whole thing, so I apologize. Thank
No,
you.
you're good. Thanks.
Rep Freeman, you wanted to come back to the table? All right, let's let Rep Freeman come back to the table. You.
Thank you, Mr. Chairman. Mr. Chairman and members, listen, I know that this is a topic that is very sensitive for people in the state and for many of our members, and I understand. I am very clear that we are a pro-life state. I read this report because we give $4 million a year to these centers. And so our legislative auditor, who we pay their staff to go and see how our money is being spent, wrote the report not because I asked them to, not because anyone in this chamber that we all serve in asked them to. They wrote it because state funds are being spent at these centers. So I heard the secretary say 13 of 39 contract now, there's additional 7 in negotiation. I mean, if I'm them, I'm going to want to negotiate more. What I'd like to do with this bill is work on it a little further. I mean, I understand that there were some problems as far as the ultrasound clinics that are one-offs in the doctor's offices. I just didn't want to get into amending something before we even talked about it. So I'd like to defer it to next week with the caveat that this is a pro-life bill. It makes me angry to have somebody sit at this table and tell me it's not a pro-life bill. I am the daughter of a physician. I am the granddaughter of a physician. And I want the babies and the mamas of this state to have healthy outcomes. And they need to have medical oversight for that. So to be insulted and told that, this is not a pro-life bill is personally insulting to me because I care about everyone in this state. And it insults me personally that someone would say this is against our babies and mamas, because this is really to help them. And if you look on page 6 of the report, Alabama did put some regulations in. So Alabama is looking at this. So he was correct about some of the other states, but southern states are looking into this because now that we have pro-life and pro-choice states, that's the land we live in, we have got to put regulations in place to make sure our mamas and babies are getting good information from the day they walk into a pregnancy clinic, a doctor's office, wherever they're going for their care. And so that is the ultimate goal here. I'm not trying to shut anything down. I just want to make sure that the patients know what kind of care they're getting. And again, I based it off of our legislative auditor's report. So consider that, and I'll be back next week with an amended bill. I'm going to work with staff and others and hope that I can have individual conversations. I apologize that I didn't get to have individual conversations before today, but I did have 3 bills plus another meeting all scheduled on top of each other, just like y'all did. So thank you very much, Mr. Chairman and members.
2 minutes.
All right, and then we need a motion.
That's it. I know. Just while we're all here and thinking about this, it's my understanding, and we're going to clarify this for later, that while other people can do an ultrasound, it has to be done under this supervision of an MD and interpreted by an MD. Is that right?
That is correct, and there's no such thing as standing orders for interpretation of an ultrasound.
Thanks. Same as someone I have represented an abortion clinic. I have represented IVF clinics. I spent time when I was very young working for a home for pregnant women and young mothers with nowhere to go. Our ultimate goal is safety for mom and baby, and that's what this is about. And thank you very much.
All right, she asked to voluntarily defer her bill. I will make a motion to voluntarily defer HB 611. Are there any objections? Hearing none, the bill is voluntarily deferred till next week.
Thank you.
All right, members, we also have HB 897 by Representative Mandy Landry and HB 931. That'll be voluntarily deferred till next week as well. HB 925 by Representative Trans Henry is also voluntarily deferred. Any objections? Hearing none, it's deferred, and we have a motion by Representative Fisher to adjourn. No objections. Meeting is adjourned.